So you're considering a breast augmentation or maybe a breast revision surgery. What are some things that I think are important for you to know? Well, first of all, let's talk about implants. Silicone gel breast implants are our #1 favorite prosthesis. All breast implants have a silicone shell. The fill can either be silicone, which is a little bit more viscous and flows more naturally, versus saline, which is sterile salt water. Silicone gel breast implants are the most widely studied medical device in the history of medical devices. They are inert, meaning there's no reaction to them, there's no allergy to them, and they are safe. I have them in my body, more on that later. The implants that we recommend have a smooth surface as opposed to textured. They are round and they change shape with you. When you're upright, they assume a teardrop shape, so they look very natural. When you lie down, they flatten out just like a natural breast. We have all different sizes available. The smallest one is 80 to 100 cc's, which is kind of like a flat hard-boiled egg, all the way up to 800 cc's, which is bigger than your head. There are differences in the width, the projection. Some are very flat, like a pancake. Some of them are more narrow and more projecting. And there's so many different permutations and combinations. There really is not a one-size-fits-all approach. Some implants have a textured surface, and there have been some health concerns related to a textured surface on breast implants. I don't use textured implants in my practice. I only use a smooth implant. And the reason why is partly safety, but also just how it sits in the body. This textured surface causes the body to grow scar tissue onto the implant, kind of like Velcro. When the implant is inside the body, it feels very stiff, kind of like a pencil eraser. If it's a shaped implant, like this implant, which always has a shape, if it rotates, it can create deformity. So I'm not a fan of textured implants because I don't like the way they look, they don't move, they don't flow and change shape with you. But there's also a potential health concern with this particular implant. There is a very rare subtype of lymphoma associated with breast implants, and that's called breast implant associated anaplastic large cell lymphoma, or ALCL. This is the particular implant which has been associated with ALCL. It's now off the market. I have never used it in my practice, and so my patients would not be at risk, and that's why we only prefer smooth surfaced implants. Breast implants are not designed to last forever. They are a medical device. You don't have to have your implants removed and replaced every 10 years. I recommend that my patients see me in long-term follow-up, initially 1 year after surgery, then at 2 years, 3 years, 5 years, 10 years down the road, and then every 5 to 10 years thereafter. As long as their implants are still looking good and feeling good, there's no reason to do another surgery. Reasons to do another breast implant surgery would include if there's a complication, if patients want a change, or if patients were to decide they don't want implants anymore. They're very easy to remove under local anesthesia in the office.